Good morning to all. I am Dr. Mohanasundaram. This is consulting physician practicing at MSV Skin, Air and General Clinic and Skanda Clinic at Annanagar Western Extension, Chennai. So today we are going to see something about how to manage our blood pressure. So blood pressure is very important because most of us are stressed in this era. So pandemic is one of the stress. Another one is lifestyle modifications and dietary habits. All those things are again stress during this period. So we will see how to manage this hypertension. So there is two aging in our body. One is called chronological aging, another one is called vascular aging. This chronological aging is the one for which we celebrate our birthday every year. So in spite of celebrating our chronological aging, so we are aging every year. So if you celebrate your birthday this year as 20, next year you will be celebrating your birthday as 21. So what we have to do year after, we have to celebrate our vascular aging. That is, we have to exercise every day to keep our vascular aging at par or less than our chronological aging. So when our vascular aging is 21 this year, next year it should be 20. For that, we have to do certain lifestyle modification. This vascular aging, which is responsible for the high blood pressure in our body. So the elevated blood pressure is responsible for all our cardiovascular and cerebrovascular events. So the coronary artery disease, stroke, kidney disease, peripheral arterial disease, everything is because of this elevated blood pressure. So hereafter, in spite of celebrating the chronological aging, which is advancing every year, our mind blogging should be to celebrate the vascular aging to reduce it every year. So basically, high blood pressure is because of stress, because of smoking, alcohol, increased fat intake, and lot of stress in our day-to-day life, and mainly the sedentary lifestyle. So it is a silent killer. There is one more hypertension. There is a lot of hypertension in its classification. So systemic hypertension, isolated systolic hypertension, and white coat hypertension. Whenever you are stressed out during your BP recording, it is called as white coat hypertension. So the recording will be high in doctor's office. The rest of the time it will be normal. So apart from all these things, there is one more hypertension called masked hypertension. This is very, very important, most of which the patient will end up with end organ damage. So what is masked hypertension is, it is masked away from the medical fraternity. So end of the day, the patient will come up either with stroke, coronary artery disease, kidney disease, or problems in the limbs. So what we have to do, we have to keep check on your blood pressure regularly. So we have to exercise regularly. So it's not possible for most of the people to exercise regularly in particular time because of their work and schedule patterns. So what we can do, there is a concept called exercise while you working. So we have to exercise while we work together. So how to do this means we have to plan our daily activity so that we are reducing our travel time through car or two-wheelers. So we have to walk along a lot of distance while we are working. So try to do exercise while you work, and you have to eat healthy diet. So what we have to do, we have to eat healthy diet which is rich in fruits and vegetables. So we have to avoid the sodium content. So this is stands for what is called as DASH diet. So that is dietary approaches to stop hypertension. So through diet, we have to stop hypertension. We have to reduce the sodium intake. We have to increase the dietary fibers through fruits and vegetables. And also we have to quit smoking. This is very, very important because smoking is responsible for damaging the endothelium in our blood vessels. This is leading to a lot of thrombotic events. So smoking, we have to stop today itself. So regular blood pressure monitoring, both the in-house monitoring, that is monitoring the blood pressure in your home, as well as in-office monitoring, at least once in 6 months if your age is more than 40. And stress management, try to relax yourself adequately. So you need adequate sleep of 6 to 8 hours. At least 6 hours sleep per day is very important. And if you are already on hypertension, what you have to do, you have to strictly adhere to the blood pressure guidelines. That is 140/90 is the current blood pressure guidelines. So this is very, very important. And try to celebrate your vascular aging in spite of celebrating your chronological aging. So try to keep your blood pressure at par with your chronological aging and celebrate every year. Decrease in aging in terms of vascular aging. Have a happy blood pressure life. Thank you.